everybody, and welcome to another episode of Combos with Care Crew. I'm Annie Solomon.
And I'm Brittany Hamilton.
And we are starting a brand new theme. So November is National Diabetes Month. So this month, throughout the whole month of November, we're going to be talking about diabetes. So why are we going to do that, you might ask? The biggest thing is we need to step up awareness. Diabetes is a humongous thing, a humongous diagnosis that we see, especially in the home care industry. And I actually didn't know this until we were preparing for this podcast, that 1 in 5 people in the United States who has actual diabetes does not even know they have it. I mean, that's mind-blowing. So, and that's according to the American Diabetes Association. So that equates to about 7.3 million people out of like 34.2 million. And they aren't aware they're living with this disease and all of the health risks that can come from not having well-managed blood sugars. So awareness really just needs to be stepped up. It's all of our responsibilities, anyone in healthcare, education and information, it just really needs to be at the forefront of all of our conversations. So, and those numbers actually are even higher for prediabetes. So the CDC estimates that in the US, 88 million people have prediabetes, and 84% of those people don't know they have it. So, I mean, that's a huge chunk of people that have the risk of being debilitated later in life from all the complications of diabetes. But we're going to kind of break this down now. So pretty much everyone, I would guess, has heard of diabetes before. Either you have had it yourself, you know someone that has it, but not everyone might understand that there's different types of diabetes. So in the past, we used to use different terminology, juvenile diabetes or, child onset diabetes, but we kind of have gotten away from that. And so we have type 1 diabetes, which is actually an autoimmune process. So in that disease, your body actually attacks the cells in your pancreas that create and make the hormone called insulin. And insulin's job is to fight blood sugar, basically. It helps to maintain and manage our blood sugar levels in our body. So if obviously your body damages those cells and it's not making insulin, then that's going to be problematic. So those folks generally are diagnosed earlier in life, typically in childhood, but not always. And their primary treatment mode is to give insulin injections so that we can kind of counteract the lack of insulin that their body has. The more prevalent type of diabetes that most people tend to be diagnosed with is type 2 diabetes. And that generally occurs later in life. And that tends to happen when your body can't use insulin properly anymore. Your body might still make insulin, but it's not utilizing that insulin effectively. And so you might have heard the term insulin resistance. That's a big term you kind of hear in different ads and in different education. But that accounts for about 95% of the diabetes cases that we see in the US. And so that's kind of the main focus that we're going to be talking about today. But there is also a third type of diabetes, and that's called gestational diabetes. Gestational diabetes occurs only in pregnancy, and it's very similar to type 2 diabetes. You might be producing insulin, but your body's not utilizing it properly and not able to get the benefit of it. And typically resolves once the pregnancy is delivered. Once the baby's born, mother's body kind of returns to normal. The only caveat to that is the research does show that women with gestational diabetes are at much higher risk for developing type 2 diabetes later in life. So even though it goes away, she really needs to always be aware that that's going to be something lingering in the future if we're not careful, that she can develop that.
And then, like Annie was saying, it is very debilitating. The leading cause of blindness, amputation, and kidney failures comes from people who are diagnosed with diabetes. It can hurt your heart. A lot of people do not realize that people with diabetes have a double risk of developing heart disease over those who don't suffer from diabetes. Diabetes is also very costly. If you factor in all the costs with medical expenses, doctor's appointments, prescriptions. It shows that on average, diabetes every year costs about 250 or $245 billion each year, just for people with diabetes, which is crazy to think, that how expensive it is to have this disease.
Well, and we all saw recently in the news too, you know, when insulin prices went crazy, that was kind of a big news story for a while. People couldn't afford their insulin, you know, and so I mean, from a cost factor, it's a huge burden for people to have this disease.
Yeah, and that brings us to our next topic, which is stepping up, you know, detecting it and diagnosing of diabetes. There are many factors that you can control. Prediabetes is a condition that can lead to type 2 diabetes and even heart diseases. Your chances of having prediabetes go up, and we'll go over those things. If you are 45 and older, if you're Black, Hispanic, Latino, American Indian, Asian American, or Pacific Islander, have a parent, brother, or sister with diabetes, if you're overweight, are physically inactive, have high blood pressure, or take medicine for high blood pressure, which a lot of people don't realize, have low cholesterol or high triglycerides, have diabetes during pregnancy, or have been diagnosed with polycystic ovary syndrome. Some people know as PCOS. And that's where Amy's going to kind of break down some of these things from a clinical side for us.
Yeah, and so a lot of people don't understand what actually you know, distinguishes the diagnosis of diabetes. How do you get diagnosed with diabetes, basically? So according to Cleveland Clinic, if you have a random blood sugar reading of over 200, if you have a fasting blood sugar, which is without eating anything. So for example, overnight, you know, you didn't eat anything, and check your blood sugar first thing in the morning before you eat anything. If it's over 126, and we measure things in milligrams per deciliter, so it was mg/dl if you ever see it on paper. So if it's over 126, fasting, or if you have something called, you know, you might have your hemoglobin A1C tested, and that's a blood test that you get drawn at the lab. That test kind of gives us an average of what your blood sugars have been doing over the previous 3 months. If that number is over 6.5%, then technically you are diagnosed with diabetes. We usually don't like to use one isolated number to do a diagnosis. You can, but I think most providers prefer to kind of look at trends. So we want to look and see, is this something that has been just trending up over time? Sometimes you could just have a fluke thing. Maybe you just ate something crazy the day before and your blood sugar was a little weird. So if there's ever a question, they might recheck you again just to see. But those are the 3 main criteria that will give you a diagnosis of diabetes based on blood work.
And that, you know, they also go over symptoms with you. So, you know, as a provider, Annie can tell you a lot of symptoms that they're looking for is how often do you urinate? If you urinate very often, and you're not pregnant, then this could be a sign of diabetes. Feeling thirsty all the time, or feeling hungry even though you just ate or you're in the middle of eating. Extreme fatigue. A lot of people don't realize that is a sign of diabetes or early diabetes. Blurry vision, you know, changes in your vision all of a sudden can happen. Cuts and bruises that are just healing very slowly. You know, they may have healed just fine a few years prior, and all of a sudden you're noticing that that stuff is taking a little bit longer to heal. Weight loss, even though, you know, you could be eating more, but then, you know, it's going the opposite direction on the scale. Tingling, pain, numbness, hands and feet, even sometimes in the arms. People don't realize that's also a sign of type 2 diabetes that could be stepping in and putting us into those criterias of diabetes.
Mm-hmm. And I know we mentioned pre-diabetes earlier, and so some people might be a little bit confused, you know, what's the difference between pre-diabetes and diabetes? Obviously, pre comes before you're fully diagnosed as a diabetic, but if we're again looking back at numbers, if your fasting blood sugar before you eat or drink anything in the morning is from 100 to 125, or if a random blood sugar is between like 140 and 199, or your A1C, which we talked about earlier, hemoglobin A1C is from 5.7 to 6.4%, then according to the Cleveland Clinic's guidelines, you are pre-diabetic. And those are, I would say that's not too uncommon. I've seen a lot of people with labs like that. So I think, like we mentioned earlier in the video, it's a very, very, very common situation. But I will say it does not mean you're guaranteed to move on and be diagnosed with diabetes. If you have prediabetes, I think the biggest takeaway is that this is your red flag warning sign. If you don't do something and you don't take some steps now, then you will go down that road. And so what we have seen in the research is that you can drop your risk for developing full-blown type 2 diabetes from about 58% by losing 7% of your excess body weight, which equates to generally about 15 pounds if you weigh, say, 200 pounds. So if you lost just 15 pounds, you've dropped your risk more than half of developing full-blown diabetes. So it doesn't mean you have to lose 100 pounds or do something crazy. Even just small amounts of weight loss can really severely reduce your risk of progressing on that road. Exercising moderately. So if you did a 30-minute walk 5 days a week, that also can drop your risk about 58% of developing full-blown type 2 diabetes from prediabetes. So again, it's not that you have to make humongous changes. It's really just getting a little bit of that extra weight off and getting a little more active, and we can really drop that risk down so that you're not one of those statistics that we talked about earlier as a type 2 diabetic. And so, we talked about how it's diagnosed, why it's important. The next big step really is, what do you do if you are diagnosed as a diabetic? Because we want to be solutions people, right? So it's scary. If you get a diagnosis of diabetes, that's a word that scares a lot of people, but it doesn't have to define you, and it doesn't have to stop you in your tracks. The biggest thing that we always harp on is communication. So sitting down and having a conversation with your healthcare provider and coming up with a comprehensive plan. So what are we going to do to tackle this? Not just pills, not just medications. It's a full lifestyle kind of approach. You want to make sure that we're tackling this from lots of different angles. So first step is going to be, monitoring your blood sugar. There's 4 big things we want to focus on. And, the first one needs to be monitoring. If you don't know where your sugars are at, you don't know how well your plan is working. Once you've come up with that game plan, if you're not monitoring, how do we know it's working? It could just be doing nothing, or, you could have reversed it already. So there's a couple different ways you can do that. Most people have seen the little finger sticks, meters that you can get, and you don't need a prescription for those, by the way. In the past, you used to. If you want your insurance to cover it, you typically will need a prescription, but you can even just, if you're curious and want to know what your blood sugars are, you can go to Walmart and pick up a test kit and read the instructions. So you have those standard meters where you have to prick your finger, get a little drop of blood, see what your blood sugar is. For diabetics, there's also this really amazing technology out there we call it CGM, which is continuous glucose monitoring. So for folks that were having to take insulin, having to check their blood sugar multiple times a day, instead of pricking your finger over and over 3, 4, 5 times a day, you can have a meter that sits under your skin. It's a tiny little thing you put, on the back of your arm or somewhere like that. You wear it for a week, and you have a little device or an app on your phone that you literally just hold over your meter, and it instantly tells you what your blood sugar is. No finger sticks required, no blood all over the place. It's wonderful. And most insurances, Medicare, things like that will cover that if you meet the criteria. And there are specific criteria for each payer, but that would be something to definitely talk to your provider about if you are having to check blood sugars very often throughout the day, so that those poor tips of your fingers aren't just tore up and, scarred over from poking them all the time. So once we are in a good routine as far as checking our blood sugar, the next step is taking your medicine. So even though, like I said, our approach is not just focused on pills or shots, you got to take the medicine. If you and your doctor have come up with a plan, you're trying a certain medication, you got to take it. So you want to make sure you're taking it as it's prescribed. and that you're monitoring for any side effects, any adverse effects, allergic reactions, and what your blood sugars are doing in response to that medication. Because not every medicine is right for every person. There's a lot of options out there nowadays. And so you want to be taking it and documenting that so that you can go back in and have those discussions with your doctor. And I'm going to toss it back to Brittany now to talk about the next steps that we need to do for management of diabetes.
So one of the next very important things is obviously eating well. New diets can be so restrictive; they can feel like we're hands tied. But there's no diets that are one size fits all, right? So you want to talk to your provider and make sure that you have guidelines of what could be good healthy eating for you. You want obviously a variety of foods, which include your vegetables, your whole grains, your fruits, non-fat dairy foods, healthy fats and lean meats or meat substitutes. So a lot of people think of dieting as restrictive and losing all these things, but it's not. You're just cutting back your carbs and going to healthy fats and just changing things up a little bit. You want to try not to eat too much of food at once. You want to go back to normal size portions instead of overeating. You don't want to try to stay away from eating too much of one specific type of food. And like we had talked about just a second ago, getting the varieties in there. Space your meals out throughout the day, breakfast, lunch, and dinner. And if you're experiencing your sugars are getting low throughout the day, you can fill in, different snacks and things like that. And the number one important thing is a lot of people assume, well, I'm going to lose weight, so I'm just going to skip meals. It's actually the worst thing possible to do is skip meals. So you obviously want to get on a regimen. You want to change all the different variety of foods into your diet, and you want to make sure that you're eating those foods on a regular schedule throughout your day to try to help keep those blood sugars lower as well as keep them stabilized throughout the day. Because the last thing you want to do is go up and down, up and down, up and down. And then the other thing we want to do is obviously get active again. Getting part of living a full and healthy lifestyle with diabetes is being active. No matter what you do or how you approach it, any type of physical activity helps lower your blood sugar. So, even walking around your neighborhood or swimming, if you're into biking, things like that, any type of exercise, especially nowadays, a lot of people work from home, even just walking around the house maybe twice. And then coming back in, returning to work, maybe the afternoon doing the same thing. Any type of exercise that's outside of your normal regimen will help keep your blood sugars lower and help stabilize them. It's also going to benefit you as well by adding some activity into your lifestyle. You're going to have more energy. You're going to feel less stressed. Your joints are not going to get stiffer and up on you. They'll be more flexible. It's also going to lower your risk of heart disease and stroke, obviously, if you're up and being more active, getting your blood pumping, your heart pumping, everything's working correctly. And then you're just going to feel good about yourself. You're just going to feel better. The first few days is horrible. I've done it myself. But the more you get into it, the more you kind of say, okay, I've got to do this. I've got to do this. You're going to realize, the increase of energy and the decrease of stress and bones aching and popping. You're just going to feel so much better about yourself.
Yeah, for sure. And the last piece really is just staying on top of all of the preventative care and screenings that are really recommended for diabetics. So because we know diabetes leads to certain complications, whether it's circulation, vision, kidney function, you want to make sure you're getting those checked. So you want to make sure however often your provider is recommending to come in for blood work, you're getting that done, that they're checking your cholesterol level every year, making sure we're ruling out that heart disease that we talked about. We're checking kidney function. We want to make sure our kidneys aren't getting any adverse effects from the diabetes. We're checking blood pressure. We want to make sure our eyes are getting checked once a year, unfortunately, because there's lots of little blood vessels in the retina in the back of the eye. Diabetics are really high risk for developing issues there. So we want to make sure you're getting a dilated eye exam. They're checking that out. That we're checking our feet and our skin every day. If sensation starts to get a little bit poor in the feet, they're real high risk for getting just a little cut can turn into a massive wound, which leads to all those amputations we talked about. So we want to make sure we're getting that checked. We're having a podiatrist even look at your feet, do foot care, trim your nails, all of that kind of stuff. and keeping up with any cancer screenings that are recommended, which those will vary depending on your gender, your age, that kind of stuff. But, right now they're still doing some research as far as whether diabetes is linked to certain types of cancer. So we want to make sure that we're doing all those screenings and staying on top of it as best as we can anyway. And the last kind of point we're going to bring is, obviously we as a home care agency deal mostly with seniors. So yes, diabetes is prevalent throughout the population in a variety of ages, but it really does wreak havoc, especially on our senior citizens. People are living longer. So there's more people that are over 65 than ever before. And so those folks are growing older with diabetes, and they get some unique challenges when they're trying to manage this condition the older they get. So like we talked about, if vision starts to get poor, they can't really have great dexterity in their hands anymore. It might be harder for them to take their medication than someone that's not diabetic. Maybe they have certain requirements as far as giving insulin injections, and they can't see the insulin pen well anymore. They can't, see their medication labels well anymore. And they might just have maybe lost their support system that they previously had. Maybe their spouse was the person that prepared most of the meals, and they're not getting healthy meals anymore because they can't cook the same way. So there's a lot of different factors that can make seniors that are aging with diabetes have a lot bigger challenge ahead of them. And if their diabetes hasn't been managed well and their blood sugars are really out of control, this can really lead to some devastating outcomes. They can have more gait problems or high fall risk because they might have some nerve damage, neuropathy. I know most people have heard that term in their feet. Maybe they can't feel the ground the same underneath them. Much higher risk for developing a fall. The older folks, once we get beyond that about 75 age range, there also is a higher risk for getting low blood sugar because of their medication. So their kidneys might not filter out that medication as well. Maybe they're not eating the same way they used to, and their blood sugar starts to drop. And that's one of the leading causes of ER visits in older folks with diabetes as well. The older you get, the more medications you have. Some things don't work with each other. They don't play nice with each other. So we get into what we call polypharmacy. We also see older folks with diabetes are higher risk for getting some cognitive impairment or some mental processing impairment, whether that's because of the blood flow not being as great anymore. But they are at higher risk for having that as another issue. Depression, and like we talked about, hearing or vision impairment. So they really can struggle so much more with the issues that are common in older folks, but they're just amplified so much more with folks that have diabetes.
And the goal of any program, obviously, just try to basically sum up everything is the best diabetes control that can be taken into account is overall health and abilities and your wishes. So, education to help yourself independently perform self-care, as well as keeping your family members, informed. A lot of people don't want their family members to necessarily know their health conditions. But this is one of those things where if you have family dinners or family outings, or family comes over and brings sweets all the time, maybe let them know that your recent diagnosis causes you to now have a different lifestyle change. And that way it helps prevent all those different things being brought over to you, or meals prep that are high in carb and completely throw you out of the varieties that you've been doing. And then obviously, just nutrition and exercise recommendations based on your capabilities and goals. No one's saying you have to go join this gym or do an hour or two of workouts every day. Like Annie and I have said, you can do small things around the house, walking, going from, your living room to your bedroom back and forth a couple of times a day. Things like that is just trying your best and overall abilities to do all the things we discussed.
Yeah. And like we said, the goal of any program that you're going to have in place, especially for older folks, is making it tailored and specific to the person. You know, what works for someone over here might not work for someone over there. Everything needs to be customized. Everything needs to be specific to that person, that individual, what their goals are, what they want their life to look like. So again, getting with your providers, making sure that you have a customized care plan in place is super important. And again, if you find that those struggles we talked about are happening with you or your loved one or, you know, a family member, a neighbor, that's where services like ours can really step in. Because we can also do RN delegation in the state of Texas, our agency is allowed to administer insulin injections. So I always use the example that when I was doing house calls as a nurse practitioner, I have a gentleman, I can still see his face today, that I recommended he move to an assisted living facility, which he did not want to do. He wanted to be independent. He wanted his autonomy and his privacy, but his vision got so poor with his diabetes that he could not managed to safely give himself his insulin injections.
Yeah.
And we gave him all the tips and tools and everything we could. You know, he had an audible meter so that it spoke to him and told him what his blood sugar reading was. But then he got to where his fingers were not able to do his finger stick anymore. We couldn't get him qualified for a continuous meter.
Yeah.
The insulin pen that he had, you know, they click each time you dial up a unit, but his hearing was not that great. So he couldn't hear that. It just got to a point where it wasn't safe. It was super high risk. And he was going to have to move out of his home, sell his home, go through all of that hassle. When if, you know, we had been able to step in at that point, we can have a caregiver come out in the morning, you know, even just for 4 hours, get him breakfast, get him up, get him going, check his blood sugar with him, and make sure, you know, we could administer his insulin injection for him, keep him at home, prevent him from having to leave where he's comfortable, and age in place safely. So again, there's so many ways that we can be able to step in, and we always offer a complimentary free in-home assessment so that you can meet with one of our team and see how we can best serve you or your loved one, your parents, whoever it is that you're concerned about. So like we always say, if you guys have any questions, concerns, if there's anything we can do to be of service, don't hesitate to give us a call. You can text or call our office number 24/7, and that number is 817-242-4717, or you can go to our website, www.carecrewdfw.com, and you can submit your information there for a free in-home assessment, and we'll reach out to you. And again, stay safe, make sure y'all are taking care of each other, and we look forward to seeing you next month for our next series with Combos with Care Crew. Bye.
Bye.